What are we doing? Why are we taping all this? See, I was asleep and he decided to do all this.
Yeah, it's do my best thinking when you're asleep. So we're just very, very glad and happy we took this extra education, and we want to make sure we can communicate this to everybody in our community.
What education?
Well, we did our degree or a fellowship in Integrative Medicine from the University of Arizona.
You all have seen me cramming at the very end of our lectures.
Yeah, that's her thing.
Well, the way he studies, he does a little bit every single day, and I just cram a whole bunch in. But at the very end, on the last day, I actually asked our professors. Mom asked what exactly degree we're getting. I really
we're not getting a degree.
We're not getting
a
degree.
Fellowship.
We just graduated.
Yeah. We don't have to include all that. That's going to be.
No, it's important. People don't know what kind of degree.
It's a fellowship, just like somebody would get a fellowship in cardiology, just like they would get a fellowship.
So we graduated with a degree in.
It's not. It'd be almost like another specialty.
Okay.
Yeah.
So we graduated from the Center of Integrative Medicine through the University of Arizona, which was founded by
Dr. Andrew Weil.
Yeah. And he has a bunch of restaurants that we like to eat at called True Food. It's really good.
It's delicious, by the way. Yeah.
Well, today, what were you going to tell people?
Well, today we just want to start off our vlog with discussing what the differences are in the different types of medicine. I thought we were already through that part.
Okay, you say your name.
Okay, good afternoon. My name is Dr. John Lucio. I practice in Jefferson City, Missouri at St. Mary's Pain Management Clinic.
And I'm Dr. Jennifer Sue, and I'm a practicing private practice OBGYN. And I like to twist my hair. That's why I did this on purpose with my curling iron this morning. I just want to keep the curls. I got that from Shea Whitney on YouTube. Thank you for the hair tips. And then I practice private practice OBGYN with an emphasis on integrative practices of gynecology.
So here today we're going to talk to you a little bit about integrative medicine and how it applies to health and wellness. Before we do that...
How long have you been in practice?
I've been in practice 22 years. So we're going to go back. Want me to include all that before...
No, we're good. We're still taping. I've been in practice for 20 years. Very enjoyable practice. And we're in the Midwest.
So we do the... Here today to talk to you a little bit about a branch of medicine that's rapidly growing called integrative medicine. And before we talk about that, we have to include some definitions. First of all, there's a lot of confusion out there about what all these terms mean. When you hear the term alternative medicine, what that means is people are using alternative techniques such as herbal medicine or Chinese medicine in place of conventional medicine. So they replace conventional medicine with these other techniques.
There's nothing wrong with that. We're not saying there's anything wrong. Right. We're just defining the difference. Right.
And then there's complementary medicine, which uses these alternative techniques plus conventional medicine. So it's inclusive of everything. And I was graduated from a DO school in Michigan State. Jennifer's an MD. And so we both still use our conventional medicine training in addition to these complementary techniques. Now, integrative medicine, what it does, it coordinates complementary medicine. That means it uses all those techniques that are out there, traditional Chinese medicine, Ayurvedic medicine, herbal medicine, knowledge of botanical treatments, in addition to conventional medicine, and it puts the patient in the center of the care spectrum, and it looks at all aspects of their lifestyle, not just their complaint. We're not here to just treat a symptom, we're here to treat the patient themselves.
Dr. Abrams said that in our medical training,
they don't know who Abrams is.
Well, Dr. Abrams is one of our professors, and he's well published and researched. And what he said that in the medical school training we're taught, let's come up with the diagnoses for a patient, boom, 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 and fix all of those problems. But instead, he said integrative medicine is treating the whole person. What else did he say? Treating the whole person. Oh, and it's patient-centered, relationship-based. Because he said we have to have a relationship with our patient to understand how to incorporate their entire lifestyle into their healing.
Right. It's not like the humans are automobile. We're all different. Genetically, we're different. Genomically, we're different. We react differently to different medications. So it's important that we understand the patient, not just their symptom, but who they are.
Right. Well, I want to give an example. there was a graduate of our program, and she was originally, it's Dr. Margaret Thatcher, or Hatcher. Yeah, Margaret Thatcher
I
is
don't know
a
if I
statesman.
mention people unless we give people permission to mention us.
But she's a graduate. And she was on a bunch of medications when she first started the program. And she ended up telling her patients, okay, when you come to me, I can give you a medication or I can give you tools to help you heal yourself. So I thought that was pretty cool. And that's the basis of our program.
Right. And personally, I had...
So maybe talk about what inspires you to study this and to study.
Yeah, what inspired me to be interested in this program?
Because we had to apply and get in and write an essay. Okay, your turn.
I forgot where I was at.
That's what inspired us, because we had to actually apply, write an essay, be accepted into the 2-year degree.
Was really just the success Jennifer had with one of the Integrative Medicine graduates of the program. So that actually prompted us to look Dr. Chris Link. He practices here in Jefferson City, Missouri. He's been our mentor and he's been our inspiration. And personally, even in my practice, I noticed that there were many, many patients that did not respond to conventional techniques or medicine. It really needed some other avenue. I personally just didn't have that information, as did many other physicians in our community. So for those two big reasons, I thought it was a very smart idea for us to pursue this. And
my dad, Dr. Weil, has been in practice for 45 years. He just retired 4 years ago. He's always done that. Like, I'd hear him, in his notes, he'd say like what they enjoy doing, what their kids are doing, where they're going to college, what their hobbies are. I think, well, that's kind of a waste of time. Why does he want to get to know all their hobbies and what their kids are doing? But it's actually important, because you find out where the person's at and you meet the person where they're at, what makes them passionate, what's their passion, and what are their loves, and what gives them joy. Those are all things that we really, as healthcare professionals, really need to listen to patients about, because that helps us to take care of them better and to give them the tools of how to heal themselves.
Exactly.
So I think that wraps up everything.
Yeah, this is our first vlog of many series that we're going to be doing. And some future topics that we're going to be covering are integrative medicine and treatment for depression, gut health and how that impacts chronic disease, women's health, and men's health as well.
Well, something I'm passionate about is self-care, and how caregivers, and you don't have to be a healthcare professional. Healthcare professionals can range from doctors to physicians to nurse practitioners to medical assistants, nurses, aides, even cafeteria workers at hospitals. How we take care of ourselves to prevent burnout, that's really important, I think, for us to take care of ourselves so we can take care of other people. So I'd like to cover that too. Managing stress is really, really important too.
I put diet too, because that's going to be an important
part.
Ooh,
diet.
Some things. Okay, let's go. Let's give it a go.
No, I taped it. It's done.
Are you kidding?
Mm-hmm.
That's been taped the whole time? I had a very terrible intro.
You do it better whenever you're not rehearsed.